in terms of public opinion, Filipinos support family planning. They think it's important. They think a husband and wife should be given the freedom to decide for themselves what method they should use. What the church has done, though, is to work in influencing local government officials, national officials, the judiciary, to put up these blockades to the full enjoyment of sexual and reproductive health and rights, especially for adolescents. Especially now with that provision in place, it's nearly impossible for an adolescent to be able to go to a health center and request for information or services. And yet there's a lot of judgment on the sexuality of young people. They are looked upon as being promiscuous, irresponsible, and yet we do not give them the tools, including the knowledge, to decide for themselves how they are to live out their sexual and reproductive lives. There were elections for senators and local officials in 2013. And one of the acts of a cathedral cleric in Central Philippines was to put up banners that named the senatorial candidates as members of Team Death, those who support reproductive health, he named them, and Team Life, those who are against the reproductive health law. And so this is the kind of high-profile pressuring that they do. They also summon legislators to their palaces, to the Archbishop's palace, and lecture them on why they need to reject the reproductive health law. So we have tried to engage, as I said, with other organizations, other groups, talk to legislators to show them that there is, in fact, very strong public support. You go through decades of public opinion surveys, and you will find public support for family planning, for reproductive health. And then we also work through schools, organizations to present, as I said, alternative voices to the issue. During the debate on the reproductive health law, women of Likhaan staged what we call a die-in. They lay on the ground pretending to be dead to illustrate the toll of maternal deaths, maternal mortality, which is 11 or 12 women a day in the Philippines. We also held a march with pregnant women, or to demonstrate the March of the Mothers, to show their support for. And then when this huge typhoon Haiyan affected Central Philippines, we also sent a team to work with the women to rebuild after that super typhoon, built vegetable gardens, etc. But also to show the linkages between reproductive health, poverty, and the need for food security, etc. So it's been a whole range of activities.